Mentioned yesterday in the preview we'd be talking about defeat. Actually, it's a infection from Brantford Podiatry. Dr. Mark Bradley's with us. Thanks as always for coming in.
Great to be here again.
Feet infection?
Well, as you know, we do a lot of surgery. We do a lot of simple palliative care like trimming toenails and cutting corns and calluses and stuff. And a large portion of our population that come to see us have other medical issues, be it diabetes or peripheral vascular disease, which puts them at great risk from infection.
So when you talk about peripheral vascular disease, you're talking about circulation situations?
Yeah. So obviously, if you don't have great circulation in the extremities of your body, little cuts and abrasions, if you get a bacterial infection through that, it can be pretty hard to control.
Okay. So the major problem, of course, is now a secondary problem, I would guess.
Yeah, and that, it's unfortunately locally in the news here with bacterial organisms and viral organisms being introduced to patients, and we've got to be very careful about that. And in some ways we're fortunate, in other ways not. We have we're a health regulated body, so we have a governing body that gives us guidelines, very strict guidelines on how we must prevent cross-infection, how we sterilize our instruments. And it's something that's reviewed on an ongoing basis. They're constantly sending down new guidelines.
Let's remind everybody, you're not a spa.
No, but some of the spas do a really good job,
right.
But they're self-policing themselves.
Right.
They can choose to or choose not to. There's certain standards they should act on. For us, we don't have a choice. So for our patients, if they come in and I'm doing something as simple as trimming their toenails, they should be seeing me opening up a sterile pack of instruments that are being used on them, will solely be used on them, and then they go off and they get physically cleaned, and then they get sterilized afterwards. And it's a fairly lengthy, time-consuming process, and as a result, we need loads and loads of instruments to try and make it through a day. Actually, we got a couple of pictures here. For example, the instruments, once they get physically cleaned, then they go into a sterilizer where they're brought to a certain temperature and pressure. Yeah, basically it's like a pressure cooker your mom used to have in the kitchen.
Yeah, okay.
But a little more organized. Again, all the packages that the instruments come in have little markers that'll react to that temperature and pressure, so they'll change and identify that the content should be sterile. Nowadays, actually in the last couple of years, not only do we do that, but we actually have to put a live bacterial sample into the sterilizer. It'll change color, we test it. So it's a pretty lengthy process to make sure that you stay on top of that. And again, as a result, as I said, you need lots and lots of instruments, but that's the important sort of thing your patient should be seeing. And when you go to a clinic, be it your dentist, any health regulated medical professional, that's the kind of thing you should be seeing, that your instruments are sterile, the environment is clean, and it's appropriate for care. And that's for someone with perfectly normal, good, healthy, general health.
So do no harm is right there front and center for you as well.
Absolutely. Yeah, that's number one, first step. And then after that, if there is a resident bacterial population, then we'll prescribe antibiotics or we'll do whatever we need to do to get that under control.
Every time you come in, you make me think about something else as we go along. And I always think now the difference between, say, feet and hands, for instance. In some cases, I can get a cut. I can say, I don't need the Band-Aid. I'm going to let the air get at it. That'll be okay. But I'm guessing feet, not the same situation because of moisture situations. They end up being closed in if they're within socks, and that, I guess, can create more problems. So I guess the coverage in some cases.
It's a very different area. In my next life, I'm not going to be a foot surgeon. I'm going to choose some other part of the body to work on that's easier. But again, common sense has got to be there. Like you were talking earlier about antiseptics, and our skin is an amazing structure. It's an amazing organ. It protects us from all sorts of variety of bacteria, viruses, and things like that. When there's a break in the skin, you need to take precautions and prevent infections. But again, our immune system is amazingly good when it's not compromised.
Yeah, it's just good words to know. So the buyer beware again, shall we say. And if you're dealing with somebody who's regulated, you're going to be a heck of a lot safer. Dr. Mark Bradley, thanks for coming in today.
My pleasure.
From Brantford Podiatry, he's the man in the know with the feet. We're coming back. Sid Bolton with the tech. John Regan's going to be